When Angelina Jolie decided to get a double mastectomy, remember that? She chose to get implants. But there's a new option for those interested in using their own tissue to reconstruct the breast. We're learning more about what some are calling a breakthrough procedure, and it takes fat from one part of your body, puts it somewhere else. New at 10 tonight, our Dr. Joe shows you how it can replace breast tissue that's been removed.
This is the procedure promising to replace what cancer took from Michelle Hartog.
I ran into somebody not too long ago, and they had no idea that I'd been through this.
Michelle didn't get implants. Rather, her husband, a physician himself, offered his wife a new, little-known option.
This is about as close as we can come to replacing a breast.
Dr. Jeffery Hartog just learned about the procedure, naturally reconstructing breasts using a woman's own fat.
The biggest instrument I use is a needle. So this is a scarless technique, essentially no new scars. We basically do liposuction and then re-inject fat in the right way.
It might sound bizarre, but fat transfers are becoming an alternative to implants and fillers. We went inside the operating room with another patient to see how it's done.
It's the inner thighs to the knees, the outer thighs, the belly to the waist.
Instead of tossing the thick yellow fluid, Dr. Bart Rademacher sends the fat to a special machine, which spins it down.
Here's all the water, and here's the actual fat that we use.
Transforming something most of us consider unwanted into something extremely desirable.
This is what we've gotten from about 360 cc, and we're going to split it equally into both bags.
Dr. Rademacher re-injects the processed fat into the breast and face.
It was by far the best option in my mind.
As for Dr. Hartog, his wife Michelle was his first patient. He now does the same procedure for other cancer survivors.
If you want a fix that is relatively complication-free, and you don't have to spend a lot of time in the hospital, and you want to use your own tissue and not have an implant, then it's perfect.
Restoring the body using a golden elixir harvested from within. I'm Dr. Joette Giovinco, Fox 13 News.
Well, this type of procedure requires multiple appointments, and Dr. Joe says that's because these fat transfers are a lot like a layer cake. Surgeons add fat a little at a time until patients get their desired shape and color.